Can you speak a little about the difficult cases in diagnosis? For example, MS versus MOG, where we understand that with an MS pattern type 2, the MOG antibody is detectable in 90% of patients.
Yes, this is a very good question, and it's referring to what was historically known as the MS pathological subsets, and these were subsets 1 through 4. And pattern 2 had a very clear antibody deposition, and so that differed from the other MS patterns 1, 3, and 4. And what we now know about MOGAD pathology, and this has been shown in cases of very clearly diagnosed MOGAD patients, is that there's a slight difference in the pathology. There's a very clear CD4 T cell deposition, and that's different from MS. And as well, there are antibodies and also complement activation in MOG patients, but there are some differences in MS pathology and MOGAD pathology. What we also know is that there are a number of patients with MS who will have typical MS-like lesions and attacks and present with a very MS-like picture, but have low titer MOG antibodies. And that is a question that the community is trying to answer now through different case series and studies as to whether those patients really do have MS and respond better to MS treatments or have a form of MOGAD. I tend to think it's probably the first option, and they probably have MS with a lot of different antibodies, which we know does occur in MS.